Hi, I'm Dr. James Powell, the Chief Medical Officer for AffordAdopt, the folks behind Recover at Home. We're a telemedicine platform that's designed to create a true envelope of care for those dealing with addiction. As we create our platform, we realize there's still a large amount of misinformation and confusion regarding addiction and substance use disorders. We decided to create some free instructional videos to help those dealing directly or indirectly with addiction. In fact, if you have questions or concerns, please give us some suggestions on our Facebook page, and perhaps we can do some videos directed specifically at your questions. Today I want to talk about two topics: classification of substance use disorder and a little bit about mindset. First, let's look at what a substance use disorder is. By definition, it's a chronic disease. It's the same as asthma, diabetes, hypertension, but yet we don't consider it that way. In fact, there's this feeling that it's a failure of willpower, but it is a chronic disease, as I mentioned. And if we start to think of it as asthma, hypertension, diabetes, our chance of success actually improves. And in fact, just like those conditions, there's not one treatment fits all. In fact, some people require just education, some counseling, medications, or a combination of all those modalities to improve their conditions. Similarly, relapse occurs in all these conditions as well. Chronic diseases have relapse. In fact, studies show that relapse rates for addiction, asthma, and diabetes are the same. So we shouldn't look at a relapse as a failure of the treatment. We have to look at relapse as the opportunity to modify the goal, short and long term, tweak the program, and continue to push forward for the long-term benefit of the individual. We do it with the other chronic conditions, yet we fail to do this with addiction. I don't want to minimize the seriousness of relapse. We all know with all these conditions, a serious relapse can ultimately result in death. But if we take a step back and we look outside ourselves in the process, if we can change some modifiable variables, including education, the appropriate diagnosis of the condition, and how we can move forward with the obstacles, our chance of success is higher. Which really brings us to mindset. We have to recognize that the brain is modifiable. It improves with effort. It improves with challenges. This growth mindset tells us that if we want to challenge ourselves and push the envelope of care, we can make improvements. Now, this isn't easy. We're talking patience, time, and effort to cause change. But if we realize that it's possible, that we're not stuck in a fixed mindset where it's impossible, then our chance of success is higher. And many of us, we can't do this alone. It's very difficult for any chronic disease process to be handled on its own. So at minimum, reach out to your local community. See what kind of groups, meetings, and sponsors you can find. Give us a call. See if we can help guide you in a direction and help create some positive change. We are here for you. This is Dr. James Powell. Thank you very much.